Hi, this is Brandon with ChiroUp. I want to talk about fall prevention today. Last year we talked about BPPV, one of the most common diagnoses that we hear that we don't treat. And I think fall prevention is another one of those diagnoses that we hear about all the time that not a lot of us are treating. So what are the things that we can do in our practice to help, one, prevent people from falling, and two, a long-term solution to prevent them from falling in the future? So the two things that I think are very important is one, addressing their shoe wear. Over 30% of people who go home take off their shoes and walk around either barefoot or with slippers. I don't know about you, when you see your grandpa, but my grandpa's slippers look a lot like this. They're old, they're ratty, they have been there for 10 to 15 years, and they think that's good enough, but that's not good enough. In fact, they need a better looking slipper and they need a more supportive slipper. So the better option is something with a rubber sole, has a firm outer sole, and now it is a better way to distribute their plantar forces, and it's a more stable shoe. So I think this is very important to change the way that people, as far as their slippers. Now, proper shoe wear is important. Over 80% of people in the last 5 years have never had their feet measured. And as we get older, as our arches diminish, or we actually have some people go into more of a supination, a pes cavus, their foot structure changes. So we need to have their foot measured. Now, you can do this in your practice, not something I do in my practice, not something that I'm going to spend time doing. However, I need to find a place to send them. I send all my patients to the New Balance store. The New Balance store is great about not only measuring their foot, but also looking at widths and putting them in the right shoe for proper distribution of weight, and hopefully a good sized toe box to prevent any kind of friction in all of our blisters and then calluses and that kind of stuff. So what can we do to assess for fall prevention? One of the number one things is the get up and go test, or the timed get up and go test. In our office, we use a get up and go test. It's just easy for measurement. You're having a patient get out of the chair, walk about 11.2 meters, and then you're going to measure that. If they can do that appropriately and quickly, they're not at risk. But when they start to do the get up and go test, or the timed get up and go test, it takes 14 to 15 seconds to get up out of the chair and back in the chair. That's a huge problem. If you want to see this test, check it out in ChiroUp. Everything's in there. So once we assess they have a problem with balance, how do we fix it? We're going to use rehab exercises. One of my favorites is actually Valais exercise. I use it for a lot of strengthening with the intrinsic muscles of the feet for a lot of my plantar problems, my orthopedic problems in the feet. However, this is an excellent test for actually stimulating all those lumbricals and really focusing on that foot tripod to get good balance, strengthening, and proprioception. You can also use the single leg stance test. This is a fun test to do, not only do it with the patient, but do it on yourself. Are you able to stand on one foot for 30 seconds without falling over? As soon as you can do that for 30 seconds on both sides, then try taking it to the next level and closing your eyes for 30 seconds. You're taking away one of the afferents going to the brain, and it makes it even more difficult for your feet to actually resist those forces. This change in balance, this change in gait that we see in our elevate doesn't happen overnight. You take people who are athletes, people who are at the top of their game. You look at Tiger Woods here, who's able to obviously dominate the field for decades, and you see this slow decline due to traumas, due to orthopedic problems, and they adopt different postures and different gaits and different ways of going up the steps or going shopping, and these are the things that we need to prevent. Some of these things are very slow, but we can often see them happen quickly. Now this is obviously in jest, but this is a professional golfer who might have had too much to drink. We haven't determined yet. But you can look here how someone with such great balance has such poor balance. Look at this really narrow width and gait. Probably not a good situation when he's trying to stand in one spot. Just by the officer looking to the left, this golfer is going to lean to the left. Fortunately enough, now he's going to stand with a wider gait, more stable gait. He's looking down at the ground, making sure he has all the possible afferents possible to keep him upright. Unfortunately, when he goes to walk, then you can see the gait break down again, and he's unable to maintain his balance. I think this is important, not just as fun. However, we see this all the time in practice. We see patients walking with different gaits. They're walking with walkers and canes and those kind of things. That is their new normal. Don't let that be acceptable. Make sure that we assess it with the time to get up and go test, and then make sure we try to correct it using our single leg stance, using valays, and if necessary, use a walker, but only in the short term. Make sure we can get all of our patients back to what they love as soon as possible, and that's where we have value in healthcare.